Interventional Pain Medicine. What is interventional pain medicine? Today we have Dr. Shivam Kumar Gupta, Interventional Pain Medicine Consultant, Rajagiri Hospital, with us today to discuss on interventional pain management. Sir, can you briefly tell us what is interventional pain management or pain medicine?
So this interventional pain medicine is a new branch, not a very new branch, but it's there since many decades. But it's a branch of medicine which deals with diagnosing and treating the chronic pain conditions, and then treating that with minimally invasive techniques. So in that, along with the medications and other physiotherapy and lifestyle changes, we do some minimally invasive techniques to treat the chronic pain conditions.
Can you tell us how is it different from general pain management or just taking a painkiller?
So whenever the patient is having some chronic pain or the pain which is there since many years to the pain, so they start taking the over the counter drugs, medicines, and they take many here and there consultations for decreasing the pain, and they in the in the meantime they will take lot of painkillers. The interventional pain medicine is the one stop where they can go with minimally invasive techniques, where we do some procedures to target the area of the pain, and there we deliver the drugs, and that will help in decreasing the pain of the patients.
So, what are the most common conditions that you treat as a physician?
So as a interventional pain medicine, there are all kinds of chronic pain patients are coming to the clinic. Like the most common condition is the low back pain, which can be of because of many causes. Like there will be disc related pain, there will be facet joint related pain, there can be the sacroiliac joint related pain, there are piriformis syndromes, and most common is the myofascial pain. So a lot of chronic low back pain conditions are there. Likewise, there are cervical headaches, cervical pain is there related to the disc degeneration or facet related pain. And one pain condition which is very debilitating is the trigeminal neuralgia, which is also called as a suicide disease because of severity of its pain. So in those conditions also we do some procedures to decrease the patient's pain. And likewise, there are many other conditions like shoulder pain, knee pain, foot pain. So almost all kind of chronic pain conditions, even the cancer pain patients are also coming to us. For them also we have some specific procedures which we do in this interventional pain management.
What are some of the minimal invasive procedures that you do to treat a chronic pain?
So there are various like treatment options, various procedures are there for specific to a specific pain. So for example, if you have some disc related pain, like we have a bulge disc which is compressing a nerve, so those kind of pain will be causing some radicular pain to the limbs also. For those patients we have transforaminal epidural steroid injection. Similarly, we have other like facet joint injections, we have medial branch blocks, and we have for knee intra-articular injection for knee pain, for shoulder pain, and for likewise I told trigeminal neuralgia, for them we have Gasserian ganglion radiofrequency ablations or balloon compression of the Gasserian ganglion. So, and also we have some invasive techniques like vertebroplasty and kyphoplasty for decreasing the pain of the wedge compression fracture which is occurring because of osteoporosis or because of the cancer related pains. So there are various and nowadays there is a recent development with the spinal cord stimulation, in which we for the which is most commonly used for the failed back surgery syndrome, which is not a right term to use. So there are intrathecal drug devices which are also used for the decreasing the pain conditions.
So, how do interventional procedures compare to surgeries for a pain relief condition to relieve pain?
So actually there is no comparison not there between these two. There are the continuum of the treatment. Like for any chronic pain you are going to deal initially with the medications, physiotherapy, and other lifestyle changes. Like then you go for the interventional pain management, and then if some conditions need surgical management, they has to be given, the patient has to undergo the surgical management for those things. So but in some conditions where the option of the interventional pain management is there it is different from surgery in the way that there will be no surgical scar, there will be no cutting of the body, only the small needle will be going inside to the target area to decrease the to deliver the drug and decrease the pain.
So, when we talk about such interventional procedures, there's always a question how safe the treatment is.
Yeah, so these treatments are very safe. There will be no not much side effect with these medications, because we are doing this under guidance of the fluoroscopy or under ultrasound guidance. So imaging techniques are used to go to the particular place and deliver the drug. So there will be not much side effect with these interventions per se. Side effects can be there because of the patient's problem itself, but not because of the treatment per se. There are some chances of, like, which is there with any other procedures which you do in a hospital, like chances of infection, bleeding, nerve injury will be there, but they are very minimal and almost nil. So it is a very safe procedure.
So, there's a general norm that pain management is done by taking opioids. How do you address this concern?
So earlier it was the case, like whenever you are going to a pain clinic, you will patient will were getting like these weak opioids or opioids as a treatment. But nowadays the trend has changed. Now the patients will get the interventions which will in turn decrease the requirement of the medications. So getting the interventions will help you decrease the amount of the medicines. And it is not only the opioids, there are many medical management is also there which we continue, and along with that there are interventional managements are also there. So it's a wrong thing that you think if there is any like dealing with a pain physician, you are going to get only opioids.
And interventional pain medicine procedures, is it only for elderly patients or can youngers also benefit from it?
Pain can occur to anybody. It can be young patients or old patients. So nowadays younger patients are coming more to the OPD because of their lifestyle changes, because many IT professionals, because of their long hours of sitting, they are getting low back pain. So it is not only for the elderly, even younger patients are also having these kind of pain. So it is there for all, younger and older. Whoever is having the pain, they can visit the pain clinic and get their treatment done.
And it can be done for all individuals, the procedures as well.
Yeah, procedures can also be done for all younger and older individuals. It's safe for all the patients.
How can an early intervention in pain management benefit a person's quality in life?
See, when the pain is not getting reduced with the medications, like if you take on continuing the medications, these medications itself has like adverse effect over the kidneys, over the liver. So these things are there. Along with that, if the pain is not reducing, then the acute pain can become chronic pain, and slowly there can be peripheral sensitization, there can be central sensitization, which can cause the pain even more severe. So early intervention will help in decreasing the pain and preventing these other adverse effect which are there to the patients. And with the good pain relief, patient can lead a healthy lifestyle, and that will help him to go with the exercise. He can do better physiotherapy. So overall the quality of life is going to improve with the interventions.
Can these procedures help the patient to reduce long-term medication usages?
Yeah, definitely. As I explained earlier, that interventions are going to decrease the pain, and it is in many of the patients, like amount of medications slowly it will decrease, tapered, and then stopped also. In some patients the medications will be continued on lower doses, so it decreases the amount of medications the patients will take.
Do you recommend any lifestyle changes along with such treatments for patients?
Yeah, nowadays lifestyle changes are very much important in our day-to-day life. Everyone should try to follow these things. First of all, we have to build a healthy lifestyle, like doing regular exercise, eating nutritious food. Along with that, posture is very important while like posture while you are seated on in an office on a chair. So that time you have to maintain a good posture, so that many of the pain problems are coming nowadays because of the bad posture which we are using these days. So we have to improve the posture. That will also help in avoiding the appearance of the pain.
So, are there any new advancements in pain medicine treatment now?
There are every day there is a new advancement in the like in pain medicine. Like nowadays there are regenerative therapies have come up, in which earlier we were using platelet rich plasma, PRPs, for the treatment purposes. Now there are stem cells, there are growth factor concentrates which are being used for treating various pain conditions. There are spinal cord stimulation techniques, there are radio frequency ablations. In that, the newer emerging techniques like cooled radio frequency techniques has also come up. So every day there are new advancements are coming up, and definitely there is a many more new treatment techniques will come, which we will be learning day by day, every day.
Thank you for your time and for all the beautiful insights. I hope this helps all the people, younger and older, in today's generation. Thank you, sir.
Yeah, thank you very much for having me.